Good morning and good afternoon to everyone. I would like to welcome you all here today. I'm your co-moderator, Tia Palermo. I'm an associate professor of epidemiology and environmental health at the University at Buffalo. My co-moderator is Dr. Gauri Desai, clinical assistant professor of epidemiology and environmental health. We're here today to talk about our role in global health as researchers and practitioners in the global north. Structural violence is defined as the discriminatory social arrangement that, when encoded into laws, policies, and norms, unduly privileges some social groups while harming others. In public health, we think about how this arrangement drives disease and inequities in health. Buyum and colleagues recently wrote that our current global health ecosystem is ill-equipped to address structural violence as a determinant of our health, and the system itself upholds the supremacy of the white savior. At President Biden's inauguration recently, inaugural poet Amanda Gorman said, "Silence isn't always peace." The interpretation that I take away from this to apply to our discussion today is that by being silent and not challenging harmful paradigms, we are perpetuating structural violence. Two leading voices in the space of decolonization of global health, Dr. Seye Abimbola and Dr. Madhu Pai, recently wrote, "What we know as global health today emerged as an enabler of European colonization of much of the rest of the world. It has since taken on different forms, for example, colonial medicine, missionary medicine, tropical medicine, and international health, but it has yet to shed its colonial origins and structures. Even today, global health is neither global nor diverse." They went on to write that supremacy is there glaringly in how global health organizations operate, who runs them, where they are located, who holds the purse strings, who sets the agenda, and whose views, histories, and knowledge are taken seriously. They suggest that in order for global health to survive its decolonization, a crucial first step is recognizing that ours is a discipline that holds within itself a deep contradiction. Global health was birthed in supremacy, but its mission is to reduce, eliminate inequities globally. We wanted to come together today to have a discussion about how those of us interested in global public health at the University at Buffalo can make positive contributions and not perpetuate structural violence. This discussion is being co-sponsored by the Global Public Health course in the undergraduate program, which Dr. Desai and I are both teaching in spring 2021, as well as our co-sponsor, the Community for Global Health Equity. You can learn more about the work of CGHE at the website listed on your screen. It is now my pleasure to introduce our panelists. We have brought together a group of faculty here at the University at Buffalo who are originally from the Global South, who now find themselves as researchers working from the Global North. We have the privilege of hearing their experiences and thoughts on this topic today. Dr. Shaanta Murshid is Associate Professor of Social Work and the Interim Associate Dean of Equity, Diversity, and Inclusion. Dr. Jinting is Assistant Professor of Educational Culture, Policy, and Society. Dr. Emmanuel Frimpong Boamah is Assistant Professor in the Department of Urban and Regional Planning. Welcome to you all. I would now like to turn it over to my co-moderator, Dr. Desai, to start the questions.
Thank you so much, Dr. Palermo, and thank you to all of you panelists for being here and sharing your thoughts on this important topic. So to get us started off, can you tell us about who you are, a little bit about your background and what your area of expertise is?
All right, I'll start. Hi, I'm Shaanta Murshid. I go by Shaanta. My work is primarily on institutional sources of individual problems in South Asia. For example, I view violence, including partner violence, as essentially structural. And in line with that notion, I locate the institutional ways in which violence is produced as part of that overarching project. I've looked at the role of microfinance, mobile financial services, school settings, and hygiene and sanitation. So what I try to do is show in pretty direct ways how violence is produced by structural institutions. And I am from Bangladesh, and I've come from Bangladesh my research is also on Bangladesh primarily. I've done some other work too. And so I think, I do find myself in the global north doing the work that I do. But and I know we're going to talk more about this later, but I think what I'll just start with is that I think what that allows me is perspective on one hand, and on the other hand, the very intense engagement that is required when one does research things like domestic violence, things like experiences of sexual harassment. So those are, like I said, very intense things to study. And I think what a plane ride to the other part of the world, which is here, allows me is the distance and perhaps the respite that one perhaps needs to really get away. And that is also a position of privilege and perhaps even power. And we'll talk about that later.
Thank you so much. Dr. Wu?
Thank you, everyone, for this kind invitation to produce this recorded discussion on decolonization and global health. I am an assistant professor in the Department of Educational Leadership and Policy, the Graduate School of Education. By discipline, by training, I'm an anthropologist and comparative education researcher. My research largely examines the inequality in education in various contexts, cultures, and institutions. Prior to joining UB, I worked as an assistant professor of education policy at the University of Macau in China. And prior to that, I was a postdoctoral fellow in educational sciences at the University of Luxembourg, Europe. So I have had the privilege of working and studying in quite several different contexts. My work so far have engaged with three main lines of topics. The first one originated in my dissertation research, deals with rural indigenous education in Southwest China. And in my postdoctoral research, I've moved on to study immigrant youth and family. And my current work, which is more in line with the topic of CGHE, looks at child disability and special education in China, but with the comparative lenses. Besides this ethnographic work, I also have a very strong interest in philosophy and culture studies because I feel that these field really shed insights on the kind of politics of knowledge production that I think has a lot of relevance to today's panel and to how the Western analytical traditions often gave us a blind spot in how we need to also draw on Eastern, Indigenous, and Global South perspective to push beyond our thinking in terms of the kind of interpretive framework are there for understanding education inequality, public health inequality differently. So I'll stop there and then I'll pick up about my intellectual trajectory in another question. Thank you.
Great, thank you so much. Yeah, Dr. Boamah.
All right, so my name is Dr. Emmanuel Frimpong Boamah, an assistant professor in the Department of Urban and Regional Planning and the Community for Global Health Equity. So by training, I'm trained as an urban and regional planner and an institutional economist. My work focuses mostly on governance or institutional questions around issues of land, water, and food systems, both in Sub-Saharan Africa and in the US. Broadly speaking, I look at questions or issues that has to do with how do we create resilient governance or institutional arrangement to ensure sustainability of our water, food, and land commons, especially within rapidly urbanizing environment. I'm originally from Ghana, that is western part of Africa, and I look forward to discussing more about my intellectual work and my trajectory over time.
Thank you, everyone, for those introductions. So my next question is to everyone, and I'm going to start backwards. So Dr. Frimpong Boamah, can you please tell us, how do you view your role and how has it evolved as a researcher from the Global South, now working from the North?
All right, thank you so much for the question. I've always seen myself as a Southern scholar. Nothing has really changed except that my office is now at Hayes Hall. But when I say or use the word a Southern scholar, I'm very specific here. I'm not simply referring to a geography, but a way of viewing myself and my research as an ongoing struggle to understand how political economic systems are deliberately designed to oppress, exploit, and commit forms of violence against people and nature. This hasn't changed over time. At some point in time, perhaps one of the things that I was really looking at is that, am I properly representing the global South in my research? And then how do I do that from a Northern context? It's still an ongoing struggle. It's still an ongoing question that I'm trying to figure out. But I think fundamentally who I am as a Southern scholar hasn't really changed.
And Dr. Wu, how do you view your role, and has it changed, and how?
Thank you. That question, actually, I have to think a lot. I share some of the sentiment of Dr. Boamah. So I will say a few words about my academic journey. It involves several transnational moves. Originally, I am from China, came to the US to attend graduate school. After receiving my PhD from the University of Wisconsin-Madison, I moved to Europe, as I said before, for a brief stint of postdoctoral research. Then I relocated back to China and took up my very first academic job there, only to find myself back to the United States several years later. So my journey was kind of circular. So even though by country of birth, I'm a scholar from the Global South, well, granted that China is now a very ambiguous category. It's neither Global South nor Global North. But let's just say that it is in the Global South. By country of birth, I am a scholar from the Global South, but through my doctoral training, I have been thoroughly socialized in the Global North academic norms and conventions. So I see myself as inhabiting multiple worlds, and neither Global South nor Global North is a sufficient category to describe my intellectual location or personal trajectory. But with that said, this movement, academic movement, does allow me to sort of begin the sort of decolonizing work from my own intellectual biography. First of all, I'm very aware that this kind of international academic mobility, it's really a way of being in a world that is strongly associated with the privileged. So we have to acknowledge that privilege to begin with. And then with that privilege, with each move that I've made, I was nevertheless forced to confront the limits of my previous knowledge and experience, to make the strange familiar and familiar strange, so to speak, and to finally, ultimately, try to open up to new ways of operating as a teacher and researcher. So in a sense, this relocation really involved a lot of disruption and perplexity for those of us who have moved. We will very well relate to this sentiment of perplexity, but also these kind of affective discomfort also lead to what I call a generative unlearning and learning. This is going to sound a little similar to what Dr. Boamah was describing. I also have this ongoing struggle between my academic background obtained largely from the West and also my continual engagement with China and the Chinese diaspora in my research, right? So this ongoing and unresolved tension is a form of question I ask myself all the time, which is how can I apply my academic background largely obtained in the West with the lenses and framework from the Global North to make sense of China in my research? Is it possible or ethical to write about China from the vantage point of the West, or can it be otherwise? So what I see is my role. I see that my role changing from sort of educating the West about China, right, early on in my dissertation work, to then really more focally challenging the limits of Eurocentric framework in researching and writing about China. So taking a critical lens of the kind of tool that I use in my work, and now most currently to try to study both at the same time. So I would just say a few words about my current work, which involves the study of disability education in China. I'm studying the Chinese Chinese special education policy, which adopts a segregate then educate policy framework, right? So kids with disability are being funneled into segregated special schools and educated there. So this model is very much different from the so-called inclusive model, which is very popular in the West. So in studying China, in studying this very particular type of disability placement in education, I was not intending to point finger at the global South practices as something that's lacking, as something that is failing the students. I proposed a component to study China and the US at the same time, even though US does not practice segregation the same way as China does. The more we look into the issue, the more we realize that the US special education policy also embody its own exclusion. So I think that to study both at the same time, looking at what works and what is at stake in both systems can really reveal blind spot and challenge us to rethink the taken for granted politics and practices in each country, especially when the US is so often seen as the cradle of best practices in education, problematically. Studying those two together really can offer a critical lens to examine the translocal power dynamics between sites. And I would just stop there. That's my sort of transformation from educating the West about China to now really studying East and West together and see what can we learn from it.
Thank you so much for that. Dr. Murshid, what is your view of your role and how has it evolved?
I agree with what Dr. Boamah and Dr. Wu just said. I think the perplexity is a part of this process. But I think, I am, like I said, I'm institutionally located here, but my research is not, and nor am I for the most part. I am essentially bilocating, which then, allows me to engage with South Asia, which is the location of my research, both by being physically present there, but also engaging with issues that pertain to that region, while also having the perspective that I do when I'm physically and perhaps mentally here. And like I said before, I appreciate that distance, which allows me to see in ways that I can't when I'm perhaps there because I'm so close to everything. And it allows, I think, me to see beyond that intensity and beyond the obvious. And that is the point of privilege. And that's something that, like Dr. Wu, and perhaps Dr. Boamah, began with my education in the West. And that's where, I've internalized and learned whiteness and white research methods rooted in positivist methods, right? And that's something that I've had to work on. And that, I think, became clear to me when I started conducting research with women from really low income households in Bangladesh. And I realized, as soon as I was trying to get my consent form through, and, which is mandated by IRB, and conduct research using survey methodology, I realized that they were all really inadequate as I tried to get them to go through a process that was foreign to them, and not just in terms of practice, but also in terms of understanding what it is that I'm doing and for whom. Just to explain to them that this is a research project and I'm trying to meet these criteria for somebody else, it didn't matter to them. They have other things to worry about. And that's the part I think that I still think about, because I think it's something that reminds me that their lived experiences benefit me and the institution that I'm in, while the benefit of my research may or may not actually reach out to them. And I think, again, that's something that a bilocating researcher probably has to sort of contend with and live with as we do this work. And the hope is, of course, that our research will have impact, that the work that we do will lead to certain changes. But we know that academic research is slow, and that the impact that our research has is perhaps even slower. And so how do we temporarily make sense of that is something that I contend with and perhaps even struggle with.
Great, thank you so much, Dr. Murshid. My next question is again to all of you. I'm going to start with Dr. Boamah. So currently, is all or most of your research in the Global South, or do you have components of your projects in the Global North as well?
Yes. So part of my work looks at Sub-Saharan. Most of my work is on Sub-Saharan Africa, but I have a couple of projects here in the US. So we are currently working on a project with the Johns Hopkins University of Minnesota, and a couple of our community partners in Buffalo and Minneapolis, looking at issues about food systems and food policy advocacy in these communities, trying to understand the factors that brings different stakeholders together, especially community stakeholders together, to push for systematic changes in their local food systems policies. And we're trying to understand this and then seeing how the generalizable some of the experiences could be applied to any other context.
Thank you so much. Dr. Wu, is your research located mostly in the Global South, or are there components here as well?
My research mostly engages with China and Chinese diaspora, so it is not necessarily in China geographically. For instance, in my postdoctoral work, I have studied Chinese immigrants in Luxembourg, which is a European country. And then in my current work, I am planning to extend the China study to become a comparative study of US and China. So I cannot tell you a lot about my future direction yet, but about my postdoctoral research, I was looking at Chinese students and adult immigrants in Luxembourg, one of the smallest European countries and one of the wealthiest European countries. So to think about their the cross-cultural negotiation that they have to undergo, and also the intergenerational conflict they experience in navigating the society and navigating the school system. So what I found was, even though the government policy very much targeted at integration, it is integration among Caucasian Europeans rather, instead of integration of all immigrants of all backgrounds. And school system also play a role to reproduce that kind of Eurocentric narratives. So it was really interesting. That was so far my only sort of research project that engages with Chinese community outside of China, but I look forward to more of such opportunities to engage with a different context.
Great, thank you so much. Dr. Murshid?
So my work is primarily on South Asia, but I am currently now also working on a project on immigrant women who experience multiple sources of violence here in the United States. So I see that as I see migration as an inherently violent process, but in addition to that, a lot of women experience domestic violence, but that's also something that I see in the context of migration and how migration leads to all kinds of stress and status inconsistency that then leads to domestic violence in certain ways. And so I've done qualitative interviews of women who live across New York State, actually, and how they've experienced and then navigated the system to seek justice for themselves in whichever way that they thought was useful for them. So there's also the notion of, the racism that is inherent to the criminal justice system. So that becomes part of that work, just by way of trying to understand how women seek help for themselves.
My next question is for Dr. Boamah. So in what circumstances do you see non-local experts as being beneficial to research or practice in a country?
That's a difficult one, to be honest. So I'll start by saying that as a Southern scholar in a Northern context, my position is more fluid. So the category non-local and local is fluid for me. So in some contexts, I'm local. In other contexts, I'm non-local. So the way I approach this question, I'm just going to say two things that I've found useful as being a local in some contexts and a non-local in other contexts. I think the first way that I've realized that non-locals could be beneficial in research and practice is when they listen more rather than just attempting to find quick fix technical solutions in whichever context they are in. So the art of listening is not just about hearing, but listening to the context that you are in, I think makes the non-local very beneficial. Then the second, which is what I'm going to conclude on with, is the issue about not assuming that non or local people are helpless and they don't know the source or the solution to their own problems. I've found that to be very useful in my own work as a non-local in a global north setting, and at the same time as a local in a global south setting. We often make the mistake in thinking that the locals are helpless and they don't know the solutions to their own problems. So here we are coming in trying to find the solutions to their own problems rather than listening and understanding why the problems exist in the first place. And sometimes it's very challenging. I can see how it's very challenging, especially when you parachute yourself into a place like Sub-Saharan Africa, like a place like Ghana. You go in there, you go to a rural area, you see a couple of kids working barefooted and then maybe drinking from a source of water that you think is unsanitary. And then all of a sudden, your solution is for you to find potable drinking water for these kids. It's great. I'm not saying it's wrong, but all I'm saying is that do you understand why that is even happening in the first place? And do you think they don't know what they are drinking from in the first place? Or are you going to be humble enough to understand why they are drinking from that source in the first place and what they think the solution should be? I think I'll leave it here.
My next question is to Dr. Murshid. What are some of the harmful ways that you've seen Northerners engaging in research or practice in the Global South?
I think the issue is really not that Western scholars are bad at what they do. I think it's they don't take the context into account. I think sometimes the issue is also, say language barriers or just not knowing the cultural context in a way that they should. And I know a lot of people learn the culture in language and go somewhere else and study those places well. And that's one type of scholar. That's somebody who's very, very dedicated. They've spent years doing this. That's one type. But there is another type that would go there for perhaps, as consultants or whatever have you. And I'll use what the term that Emmanuel just used, parachute, where they parachute themselves in and then provide expertise. And so I think that's the kind of expertise that these communities don't need. But on the other hand, I think the problem is that we, and I say this about South Asia, I say this about other post-colonial spaces, we have colonial hangover. That's something to think about. White people still have a lot of power in those locations. It doesn't matter what you do. You don't even have to be that smart. You go to, a country like Bangladesh, you say a few things in English, people think you're smart. And they take your word at face value. And that is a problem, And I think there's so much privilege associated with whiteness in those parts that we just end up seeing a lot of bad research, I think, and harmful research. Because bad research isn't bad because they're badly written papers. Bad research is bad because they don't take the context into account. They're not actually benefiting the communities that they're studying, but they're becoming stars of those areas, right? So they do, it's called area studies and so on. But they're now stars of certain populations, and I think that's very, very problematic. And I think it's problematic also because I think they would think that they have buy-in because people treat them like they're doing a really good job, because your local community would tell you that you're doing a great job, and that becomes harder to discuss because then they'll say, no, I have buy-in. All these people think that I've done a great job. And so, so I think you see the problem there, right? It's kind of like a catch-22. Like, how do we resolve that? I mean, I can think of certain ways, but we are not in that space, I think, right now. And I think we need to be. I think we need to make sure that people understand cultural context. And I know people say that all the time, but but that means something. That means that you understand how problems take place, how problems come into being, what the root causes are. And I said before, like I think it's important to understand what is happening beyond the obvious, something that also Emmanuel pointed to. Yeah, it's obvious that, say, violence is a problem, that many women report violence, but why is that happening? And what kinds of solution do we need? And to say that, yeah, the men need to do better, that's not anything. But you'll see a lot of rhetoric like that basically is, I think, a racist reading of violence as well, where certain men and certain men of color are deemed particularly problematic, particularly violent. And so yeah, I think there's a lot of harm that can happen when white scholars, if you will, go to these spaces and do the research they do with perhaps the best intentions, but still fail at articulating what's important, but not be called out for that because they have privilege. I'll stop there so that we can get to other things.
Thank you for those really powerful insights. The next question is to everyone, and it flows along with the last two questions, but perhaps we can start with Dr. Wu. So is there a role for Northerners or white scholars or Westerners in public health practice and research in the Global South? So remember, some of our students are not necessarily looking to be researchers. Some want to be practitioners of public health or perhaps global public health. So is there a role for us in Global South setting? Maybe we can start with Dr. Wu for what do you see as the role for practitioners and researchers in the Global South?
Sure. I think that we must not enter the field of public health thinking that this is purely a health issue. Oftentimes we take public health too literally, as Shaanta and Emmanuel have amply demonstrated. Health issues oftentimes a cultural, structural, socio-political issue. So we must not enter into the field with a singular understanding of health, and also we must not enter into the field with a cultural and ahistorical lenses, right? So we need to be very sensitive and humble to what the field tells us. So be a student rather than a researcher or a practitioner or a giver of knowledge of some kind. Instead of testing our pre-existing knowledge on the empirical data collected from the Global South, we should also make an effort to let go of our learned biases and really use this opportunity to unlearn and challenge our own framework. I think the world and the people in the South exist not just to be described and analyzed, but really to reshape the way we know and understand public health. And I wanted to give an example in my own research about this ideal of parachute scholar that has been discussed before. This is the community I enter into. Oftentimes think about research as a dirty word, right? Because the more eye-catching the problem is, the more attention they attract. Not just institutional researcher, but government researcher, journalist, all sorts of stakeholders pour into this area to overstudy them. And in that sense, that our product, our writing, our research report can become a tool of violence as well, because the kind of narrative we produce ended up reinforcing the images that are then globally consumed about these communities. And eventually they think research is a dirty word. They reject any kind of effort to engage, right? So I think that this is a really exploitative form of so-called data collection, treating the Global South as a data mine and the Global North as a theory mill. So you go there and collect data and you come back and you churn out articles and publications about theories. And then most problematically, most of the publications are written in English, consumed by an international audience who are looking up to that standard. So we are actually missing out on a whole other way of looking at these issues, which may not be entirely accessible by an English audience. And for those of us who are, multiply located, who speak the language, who really are dedicated to the people, to take the approach, the so-called the slow cooking approach, which is, as Shaanta described, go there. If you are not from the community, go there and live an extended period of time, have a walkabout experience, not just go there, parachute and leave, but have a walkabout experience, get to know the people, ideally learn the language, right? One of my graduate school mentors used to say that the only reason for you to hire a translator when you are studying a culture different from your own is when you actually know the language. And that was a very powerful comment, because he said, precisely when you know the local language, you will understand when people are telling you the truth or not. And then you will start to unpack, why are they telling you the truth, or why are they not telling you the truth? So you get to a whole level of complexity that will otherwise not be available if you hire a translator, if you only talk to people who speak your language.
Dr. Murshid.
Hi. No, I so hear that, and I've seen that in practice. And just a note about translators. I think, well, that's a great service that people provide, but that's absolutely not how research should be done. If you're doing research in a community, you should know that community. And I think too many people have gotten away with doing that kind of research, which lends it credibility. And I'll add that I speak Bangla. I was born there. I am from there, but sometimes I have a hard time understanding my research participants. So it makes me wonder even more about research that is done indirectly, because there is so much nuance. There is so much so complex. The complexity is so rich. So I think it's so important to understand that language, and then understand the colloquial language, and then understand the nuanced ways in which there are regional differences between people, and then understanding the idioms that people use to describe certain things. So there's a whole list of things that has so much import for how the research pans out. And so when I read research where people sort of come up with really great conclusions, I am always slightly suspect, because how did that happen? Because I know how difficult it is to come to one conclusion. The other thing that I think is sort of important to think about is how you talk about yourself, right? So a lot of researchers and research in the humanities and also the social sciences focus on the me and the I, right? And so I think this and I do this. And I've wondered about that. And I'll say this because I've written papers where I use I and then I use we, even though it's just me. And then sometimes I wonder, when I am centering myself in a research about marginalization, then what does that say about the work that I'm doing? Is it really about what I think? And is it really about how I frame the issues? And so I think being a researcher means to be really careful about your own location and your own privilege, I think. I'll stop there.
And now just to turn it over to Dr. Boamah. So you've engaged in a lot of work also with WHO, oftentimes dealing with the practice of public health. So, is there a role for Northerners in public health practice and research in the Global South? And what ambitions and goals do you have for graduate programs in global health here at UB?
All right, thank you so much. The second part of the question, I think, may be a little bit too much above my pay grade, but I'll still try to offer my own personal views and visions and aspirations for any future work in the Department of Urban and Regional Planning and the CGHE that wants to do global work. But let me first start with your first question, which is about, is there a role for Northerners in public health practice and research? So this is how I want to understand, or I would like to start the conversation. Yes, there is a role for them, but the more important question is that, is the role about they going into some of these global South countries and presenting their expertise to them? And that is not really what I think it should start from. the role that Northern practitioners and researchers need to consider first is what has been their role, or the role of Northern policies in creating the kind of problems that we see in the global South. What I find oftentimes a little bit surprising and then maybe disingenuous is that we go into some of these global South contexts, we see some of the public health challenges and then other problems that they are facing, and then we automatically think that these are problems that are created within the local context. And this is one of the things that I teach in my class in Cities and Globalization. And then again, I think Dr. Wu also started talking about it. If you take a historical and cultural understanding and structural understanding of some of the processes that some countries in the global South have inflicted different forms of wounds or violence on some of these global South countries, then the question is, the role or the issue is the role of Northern practitioners perhaps is first to talk about how they have been complicit in creating some of the structural and systemic violence that is happening in the global South. They unpacking, or all of us, I'm also part of the Northern Scholar, we unpacking how we've created different forms of policies, whether deliberately or not deliberately, in trying to inflict different forms of violence on these people that manifest in several different ways, including public health challenges that we end up going there and thinking that we are trying to solve. We created the problem in the first place, most often than not, and we go there and we try to say that we are going to solve it. Maybe that is where our role should start from. We having a deep introspection of what we have really done historically to some of these countries. I think it's where the conversation should start from. And that, I think, is the role that we haven't taken too seriously, in my opinion. I think we often want to blame them for the problems and we want to fix the problem for them. That is not what we should be doing. Let's ask ourselves what exactly we have done in this context. To also touch on this issue, I think the question also about the harmful ways, I had a thought about when you asked the question about in what ways we've been harmful to some of these research and practice in the global South. So about 2014, I saw this book by William Easterly that talks about the tyranny of expert. And in that book, he was trying to make an argument that we frame some of the problems in global South context as technical problems. And it really stuck with me so much. The moment we frame the problem as a technical problem, what it does then is that it starts excluding certain voices. And those voices often excluded are going to be global South scholars and experts or practitioners or voices that often cannot speak in the English language and cannot express themselves in the languages that we Northern scholars and practitioners present in some of these contexts. And so the harmful ways we have been is especially, or is most manifested in how we frame the problem, which often becomes exclusionary in its very definition. And this is part of the reason I'll be in the same room, and as someone who may have done a research in Ghana may think that they know even Ghana more than I do, right? Because it's not really at that point about the person doing the research, it's about how they frame the research as a technical thing, which they may think of me as not a technical person. And I think that is what we have to start watching out for. And I think Dr. Wu and then Dr. Murshid started talking about this, and maybe I would just like to say something about that. We have to be also very cognizant of this global capitalist and exploitative knowledge value chain that has been created. It's very, very important for us to pay attention to it, because this is the chain that allows some of us as Northern scholars take grant money in our context, go into some of these countries, and sometimes not even pay the people we call as community partners. We don't also give them any form of credit when the data that we've extracted from this context has been processed. And then we get to take all the credit in terms of how we publish and then who we even publish with. And I think that is something we have to start talking about it seriously. I know there are certain funding agencies that even make it difficult for Northern scholars to even pay their partners in some of these global South contexts. Are we talking about it? We often frame it as if the research is ultimately going to benefit these people. Therefore, let's exclude them from the funding sources. forgetting that they also have institutions to also maintain. Let's bring that conversation to attention, right? And this issue started, Dr. Murshid and I have had conversations around this in some context. I know Tia, you and I also started talking about it in some context as well. But for me, as a Southern scholar, one of the ways that my mind came to this global capitalist exploitative value chain was when one of my former mentors, we decided to map the publication site of certain disciplines where certain publications have appeared. And then it became obvious that there are certain publications that do not appear in some of the global South countries. And this has often been framed in some disciplines as dark spot, knowledge dark spot. And we wanted to contest this argument that they are really knowledge dark spot, which we often manifest in global South context. If you are a researcher and you go to a place like Ghana or Bangladesh, and you collect data, you process the data, and you publish your work, and you have your institution in the global north as the institutional affiliation of it, are you genuinely the owner of that knowledge? Where is the knowledge really coming from? Is the knowledge coming from the site which actually processes the data in a way that meets this Western-centric knowledge frame? Or is the knowledge truly from the context within which you extracted the data from? That we often want to think of them as non-expert, non-insightful, or non-informed people. Who actually owns the knowledge that we often tout ourselves as being expert in? That is a conversation we need to have. Now to your second question, again, my apologies for ranting and going on there, but it's something dear to my heart. But the second question about what should be, or what I feel my vision and an ambition for any kind of global related work that involves students and faculty in the global South. I will start by saying that it first needs to be, or such programs, if I'm involved in whichever way, I want it to be a space where global North student and faculty and experts get to understand that the problems that they are facing in their own context could actually or equally be solved by some of the people in the global South. They have to understand that just that even though the people in the global South cannot speak fluently in some of the languages that we present in the global North, it doesn't mean that they don't have ideas even solving some of the problems that we have here. So it's supposed to be a space where it's mutually learning. They teaching us as much as we also teaching them how to solve some of the problems that we are facing. And more importantly, I also hope that such a space offers room for students to be able to communicate in the most humble and genuine way with their global South student. In other words, we have to find ways and means of bringing some of the students here so that our students can get to have conversations with them in a very genuine and authentic manner, which we should include we giving funding for the student to come here. Again, it shouldn't be all about we pushing students in some of these contexts. We also have to bring their student or student from the global South here for them to also learn and then teach us how to do certain things in our own context. Maybe that is where I'm going to leave this, and maybe others can continue from there.
Yeah, that was excellent. And please, no apologies necessary for continuing on. Those are really important points you're making, and really underscoring a perspective that we're trying to bring to our students this semester. And I really, some of the questions that we had were, what skill sets might be most useful for people who want to engage in this work. But I really love what you're saying about how, we really need to think about this. Yes, there is a role for us, but that role might not be solving a technical problem with our technical skills on the ground, but rather recognizing how are we contributing at much stronger and higher levels to these problems we're seeing on the ground, our contributions to climate change. So yes, there might be flooding and drought in certain populations, and how can they become more resilient and adapt to climate change? But what is our role in disproportionately driving climate change? And also in tax avoidance, a lot of countries have a lot of natural resources, and the profits are being extracted back to Europe and the US. And then we talk about how governments aren't collecting enough taxes to fund their social programs, and we just need to get those governments to start collecting more taxes from their population, when we are just completely ignoring the fact that Europe and the US is benefiting from those corporate profits, and none of that is getting turned back into, the government tax base. And in addition to that, how do we think about our migration rules and who we allow to have visas and who we allow movement to here in the global north? So maybe our contribution to solving these problems is not about what technical and language skills we need on the ground, but how do we get our own populations to understand the role that we are playing in driving these problems from a much more, and oftentimes I think people are turned off by the term structural, but it is a structural problem when we're driving this at such a higher level. So I'm going to turn it over now to Dr. Desai for the next questions, but I do thank you all for these, very insightful points.
I want to change the focus just a little bit to focus more on students who might be interested in working in the field of global health, either as researchers or in terms of practice. What advice do you have for both undergraduate as well as graduate students who want to work in global health? And we can start with Dr. Murshid.
Hi, again, that's a hard one, but I'll start with empathy, because I think that's the first thing that one needs, to be empathetic to the problems and the sources of those problems, right? And then recognizing their own roles in producing those problems and the roles of their own governments and so on. But also, empathy isn't enough. Is it really possible for a white male student, and I say that because that's the hegemonic student, right? For in a university like ours. So is it really possible for a white male student to step into the shoes of, say, a Bangladeshi, girl, but from the Chittagong Hill Tracts, which means that she's from an indigenous group? Is it really possible for him to sort of walk into her shoes and then understand what's going on? I think even expecting that is a lot, because that doesn't happen even if somebody says that it does, right? And I think we know that. And so I think there is empathy, and there is a need for empathy for what it's worth, but not just that, which means we need to go beyond that. And what does that mean? I think part of it is what Emmanuel referred to before. Learning from students of color, learning from students who are from the global south. And I think sort of turning around that process, right, where students from other locations have usually come here to learn American ways and take them back to their countries of origin. That has been how the United States have sort of spread its tentacles across the world. That's how even neoliberalism spread across the world, right? And that, again, is a source of a lot of conflict in global south spaces, with buy-in from these scholars that have been produced by the United States. And so I think we need to sort of undo that and sort of do a flip of that, right? And so that people here, students here, learn what that process has been, and then learn that that hasn't worked. And then I think it's important for students to question their own biases. I think the first thing that I would ask a student who's interested in in the global south or in global public health is, think of a country in the global south. So now you've thought about a country, and now tell me the first thing that you have thought about that country. And that would probably give you an answer to what biases you have, and then address those. So I would say that has to be the first step.
Thank you so much. Dr. Wu, what advice do you have for students who might be interested in global health?
I will start with the keyword health. To understand health in a more comprehensive way, that health is not just a physiological condition lodged in the body. It is profoundly shaped by, cultural, historical, colonial power assumptions, and also about what is considered the body normative, right? And oftentimes we think about health in terms of its opposite, which is unhealth, and there is a normativity involved in it. So what is considered health and unhealth is often not universal, right? And just beware when we take our Western head and go and define a problem as a health problem, we are probably just being wearing that normative head. So think about health as a cultural and historical concept. I often think about this book. I am sure that students in public health have heard of this. The Spirit Catches You and You Fall Down, which is a journalistic account, but it's very scholarly too, about the encounters of a Hmong refugee family with Western medical community. The book is really considered a classic, right? The story really was revolving around a Hmong child diagnosed with severe epilepsy. So the Western doctor insisted on using very regimented medical treatment to cure this child, whereas the family was very non-compliant and very upset about the hospital staff's ignorance and ignoring of their Hmong culture taboo, and also their desire for spiritual healing. So you see that two sides, their understanding of the causes and treatment of the illness could not have been more different, right? So it is quite a tragic story of cultural misunderstanding and how the Western medical science fails to incorporate a cultural dimension in treating patients more than from a techno-rational perspective, right? So I think that ideal of health not being something purely lodged in the body is one advice I would give to students. And then the second thing is the domain of health is so much related to people's beliefs and values, right? So almost as if you need to study health from a perspective of humanities, to study values and beliefs, right? So I think there are three levels of information we need to obtain when we are working with a community on a health issue. First, what actually happens, right? The second question is what the people think happens. And the third question is, what do they think ought to happen? So the first question, what actually happens, deals with the sort of a matter of fact, description. The second question, what people think happens, deals with belief, right? And really question the positivistic understanding of health data, so to speak. And then the third question, what do they think ought to happen? What they think ought to happen concerns their value, right? So we have to deal with these three different kind of layers of information when we go out there to quote unquote collect data or ask people about their health informations. And then to really be able to understand this three level of information, students will need to have a cross-cultural competency and also interdisciplinary perspective, right? To be able to do that. And then the last thing, I think my colleagues have spoken about this quite a bit, that is that we must not forget a public health setting is profoundly intertwined with power dynamics, right? A health issue is it's an issue about power. So I'll give you an example. We live in COVID time still, right? The first episode of COVID outbreak was traced to a food market in Wuhan, China. And what happens after that was, the virus was subsequently nicknamed as the China flu or the Kong flu, right? So it is a public health issue, and yet linking a public health crisis to a particular geography or a cultural group really has the detrimental effect of racism, xenophobia, stigmatization, right? And as higher education spaces, we really need to push our students in thinking beyond those terms and come to recognize public health issues. It's again an issue of power. And then another example related to this is, a simple public health practice such as wearing a face mask can be also a deeply politically divided issue, right? So again, those are really simple examples to show that health is not just health, that's simple. And we need to really look underneath the normality of the public health protocols we uphold in our community, be it West or North, somewhere else, and really to try to see what are some of the deep-seated cultural assumptions, cultural superiorities, and knowledge hierarchies that we speak from. So those are the three things. But I think students need to take a class outside of their home department in school, because that's the only way they sort of challenge their assumptions. And because I'm from the discipline of anthropology, which is equally embedded in the colonial history. But aside from that, I would encourage students in the public health to take a class, perhaps from medical anthropology, to understand health from a more cultural perspective. Of course, there are other fields as well, but that's just one suggestion to broaden your perspective.
Thank you so much. Dr. Boamah?
Wow. So I think everything has been said. Honestly, I feel that all has been said. If there's anything, maybe I'll just reiterate what has been said in some ways. As someone who's trained in a professional field, where oftentimes we are given several tools and skills to solve problems. Whenever we are thinking of any social issue, the first thing we think about is what is the solution? And for students who want to engage in public health or global health, one of the things you should understand is that rather than asking the how questions, let's be more comfortable asking the why questions, right? So this to me was very valuable. It's a lesson that my doctoral supervisor taught me. It was that it's not always about finding the solutions. Sometimes the solution is actually understanding what exactly the problem is in the first place. So let's be comfortable in any class, in any kind of discipline, in any kind of work that you do in global health. Sometimes the goal is not to find the solution. It is about how, understanding. Just be comfortable not finding solutions. In professional worlds, we often want to find solutions to everything. And again, I'm speaking as a planner, and that hasn't really been helpful, right? Because this is what we do. Even when you hear the name of the profession itself, planner, so everything has to plan. You have to find solutions to everything. And because of that, we've come up with several different solutions that have created multiple other problems. And that also leads to my second thing, which I think Dr. Wu already started touching on, which is about sometimes the solutions we propose will lead to other forms of problems in themselves. And do we even take our time to understand the solutions can actually create a problem in another context? I learned the lesson from working with Dr. Murshid's, one of Dr. Murshid's project, where we're talking about just women violence and then access to mobile money. And then the solution, the obvious solution is that why don't we give women the chance to have their own money to save? And then that ability for women to have money to save in their own context could create another problem, i.e. experiencing violence from their partners. So if I go into a community like this and I say, oh, women are not able to save, so why don't we give them the opportunity to save? Am I also thinking about the other problems that it's going to create as well? Or am I just comfortable solving the problem that I think I see? And that is why, again, I say, asking the why questions rather than the how question, we should be comfortable with that. Planners have been taught to understand problems as wicked problems. This is what we call wicked problems. And public health problems are wicked problems. What it means then is that solving it can create several different problems. And then your goal as an expert is to understand sometimes the why questions so that you can create solutions that do not necessarily lead to other unintended problems for your population.
I'm going to add just a comment, which is, we talk about unintended consequences quite a lot when we're thinking about interventions, particularly, interventions at a large scale, like microfinance, I suppose. And, I have and I used to too, like when I was in grad school, that's how I framed like domestic violence as an unintended consequence of participating in microfinance. But I think I've changed my mind about that. I don't think it's that unintended anymore. You know, I think people are people who do this work should know that this is a culture, and I mean a global culture of patriarchy that we live in. And when patriarchal norms are threatened, there will be violence. We know this, right? And so we also know what can threaten patriarchy and patriarchal norms, right? And so when that happens, which is what additional access to money via microfinance is, then the violence is inevitable. It's not unintended. The actual goal of microfinance really was to expand the market for financial products to include those who had thus far been unbanked. That sounds really empowering, but what it really is that it expands the market to include people who were up till then not part of the market. So this is a business model. This is not empowerment. And I think that's the kind of, obfuscation that allows certain problems to kind of remain, right? And I think that's what we need to be aware of. So question everything, when and I say this at the risk of sounding like somebody who is okay with, say, conspiracy theories, which I am not, but I say this because we really need to question everything, because I think as a culture, again, a global culture, we are at a point where anti-intellectualism is everywhere, where we sort of have decided that science doesn't answer questions, where we have decided that education is no longer required. A lot of harm happens when we have these thoughts, particularly when science itself also has problems, right? So when we're trying to fight for science, and if we're not able to have a conversation about how science also can be a source of violence and problems and all kinds of like exploitation, then we go backwards, right? And I think that's what we need to sort of invent, I suppose, this culture of intellectualism where we can have these discussions where we again focus on science, and we focus on what we need to do, and focus on not intentions but outcomes, like a pragmatist, sure, but still outcomes, because it doesn't matter what the intention of, say, something like microfinance has been. The outcome that I've seen is that many women experience domestic violence as a response to the cultural shift that happens when women participate in income generating activities. And so that's a problem that could have been resolved. That's something that could have been taken into account. That's something that could have been done by providing perhaps loans in which it came with some kind of educational tool where you'd have, say, couples counseling or something, like anything. But nothing happened. People were just given pots of money, and then automatically somehow they were empowered. And we know that's not how that happens. Again, empowerment has become such a dirty word as well, right? And it has, because what has empowerment done? What has empowerment done for us? And what it has done is it has allowed, say, corporations to use that as a way to get into people's lives. And I think that's a bit of a segue from what we were talking about, but not really, because I think public health and public health interventions have similar kinds of I guess ideas associated with that, right? Like, here's an intervention that works because it's good for all these reasons, one of which is, it'll empower women and it'll empower, marginalized populations and so on. But it might not. What does that even mean? I think empowerment has been depoliticized in ways that I think we don't even know what people mean when they say empowerment anymore. And so I think I'm gonna just say that, and then also add, sort of remind us of what you were saying, Tia, before. Tia, when you said public health has this history of saviorship, I think, it sort of really resounded with me, because it does, because I think when even students get into studying public health or even like social work, they do it because they want to make a change in the world. So it's this kind of savior complex that gets them to study these things. But that's exactly the complex that has to be undone for them to actually do the work that they want to do.
Thank you so much for that. So I just want to give everyone an opportunity now and maybe a minute or two just to give us any closing thoughts that you might want to add to wrap up before we end here. Dr. Wu?
Sure. I think we haven't touched upon the funding question, so I will say a few words about funding. For someone, I myself come from the social science, humanities-oriented social sciences. I often find that funding agencies tend to favor instrumental questions, problem-solving kind of questions, such as what are the treatment of a particular public health outcry, right? Very hot topic. But funding agencies tend to pay less attention to foundational issues of ethics, values, power dynamics, right? So I think this is a very unfortunate situation because it can contribute or reinforce these equity issues that we have been extensively speaking about. So take COVID for example. This is the news article that I used for one of my classes last semester to think about who are the people that government invite to serve on the nationwide COVID advising council. You will not be surprised. In France, in UK, and in much of the rest of the world, these councils are almost exclusively composed of disease experts, epidemiologists, virologists, system engineers, and scientists, right? So this is pretty much the norm. However, in Germany, right, which has a long tradition of valuing the voices of the humanities scholars, the state actually enlisted philosophers, historians, theologians, right? These people who normally don't have a role in the disease related panel, they invited these scholars to discuss the ethics behind government policies. For instance, when should we open a society? Whether should we open the society, whether the opening of society will safeguard, will infringe on the freedom of the public, right? The ideal of how lockdown will exacerbate education inequality, and whether the government will unintentionally or intentionally hoard power during a public health crisis. These are the questions that disease experts tend not to focus on, and yet these are very important because whether or not we pay attention to it, they are going to haunt us as a society. So this is my final thought. I think that funding agencies are very powerful. It oftentimes direct where the researchers are locating their gaze, right? And then our gaze again has a domino effect in terms of producing research output, in terms of the kind of interaction we have in the field. So the funding agencies are at the top of the food chain. So they need to change, and they need to change to incorporate more value-based and equity-based questions into their traditionally solution intervention oriented outlook. So that would be my final conclusion.
Dr. Boamah, closing thoughts.
Right. I think Dr. Wu really captures very well what was really at the top or at the back of my mind. This is it. And again, I'm sure when we talk about funding agencies changing, we are not just saying embedding one or two questions that says that are you engaging in equity or something, or gender or something in your questions that you ask researchers to fill. I think it's about also making that deliberate and conscious effort to making money available to humanities, those who study the why questions. Again, this to me is something that has been at the heart of my mind, at the core of my mind and in my research for so long a time. Understanding the why questions. So if I'm going to leave the student with anything, what I'm going to say is, one, when you think of public health, think of it as both having the front-facing and then the back-facing end. The front-facing is more about applying your technical skills in dealing with some of the challenges, the health challenges. The backside is asking the question, why are the challenges even coming up in the first place? And for you to understand those why questions, oftentimes you realize that it's not just about taking courses in public health, like Dr. Wu was saying. It's about also taking other different courses outside your domain areas to understand some of these why questions. I think we have to really value that in there. And then two, like I said, again, I'm just going to repeat myself at this point. Be comfortable not finding solutions. if only you can understand why the problem is in the first place in your class. Be comfortable with that. I think in the neoliberal capitalist society where everything needs to be about finding solutions that oftentimes end up in the hands of a capitalist to appropriate or make profit from it, we have to be careful and having slow scholarship, which some have talked about. Let your scholarship or your understanding in your classes more be about understanding the problem rather than being quick at finding solutions, oftentimes to meet some of these funding agencies, their requirement over there. I think the conversation will be broader than what we can do in this class or in this session, but I'm sure we've given you enough for you to start thinking about it. And we also hope to hear more from you, from your instructors as well.
And Dr. Murshid.
Well, so much has been said. I will perhaps end with the idea that, we live in a system of white supremacy, and global health under this system is inherently biased. And so as you check your own biases, students, you should also look at ways in which biases are produced and reproduced in the systems in which you are a part of. And that's this institution that you're in, but also the institutions where you will perhaps work at when you graduate. So I think that's my last bit. I think, we all have biases under white supremacy. Everybody does. Everybody's racist under white supremacy. It's inevitable that we are, and and not just white people, but everybody. Because that's the system. That's what has currency, and that's what has power. So aspiring to whiteness is of value, but those are the systems that we have to undo and dismantle if we actually want to create a world where there is equity, where there is equitable distribution of resources. And that is what I have.
Thank you for that. So really, I just, on behalf of Dr. Desai and me, I would like to thank you all for your insightful contributions today. This has been so enriching and such a pleasure to speak with you all today and to hear your experiences and your thoughts on this topic. We look forward to continuing this conversation together here at the University of Buffalo, and thank you for your time and giving it to our students and carrying on this conversation. Thank you so much.